Good morning, dear students. Today we are discussing about Mantaux Test. Mantaux Test it is the tool for screening of tuberculosis and tuberculosis diagnosis. It's also known as Mantaux screening test, protein purified derivative tuberculosis screening test, or tuberculosis skin test. It is used to determine if a patient is infected with mycobacterium tuberculosis. Principle it's based on a delayed type hypersensitivity reaction. Mycobacterial antigen is available in form of protein purified derivative. 5 units of ppd, that means 0.1 ml. It is injected intradermally with a 26, 27 or 30 gauge needle. The results will be read between 48 to 72 hours for duration. After injection, cytokines are released by Th1 cell to attract granulocytes and macrophages that will cause induration and erythema. Delayed hypersensitivity reaction will begin after 5 to 6 hours, and it will be reach between 48 to and 74 hours. Then requirements, spirits of ppd or tuberculin graduated 1 milliliter syringe. Then its procedure, bring ppd reagent to room temperature. The preferred site is the dorsal surface of forearm, about 4 centimeter below the elbow joint. Then disinfect the site of infection and allow to dry. Then we draw just over 0.1 ml of ppd by using 1 milliliter syringe, and remove excess ppd to make exactly 0.1 ml, and remove air from syringe if that present. Then using 27 gauge needle, that will be injected intradermally with 27 dermally to make deposition wheel in the diameter of 6 to 8 millimeter. Then mark the area of injection with indicator, and read the result between 48 to 72 hours for getting induration. Induration means the redness will be produced at the site of injection or elevated hardened area. Then it results duration of greater than or equal to 5 millimeter, and duration of greater than 10 millimeter, and duration of 15 greater than 15 millimeter, and results after 40 to 72 hours of administration. The reaction should be measured in millimeter of duration. Then erythema is not significant, so it does not be measured. According to CDC, Center for Disease Control, it depends of two factors. First one, measurement in millimeter of induration. Then person's risk is being infected with TB. Then duration of greater than 5 millimeter, human immunodeficiency virus. Then contact of TB case patients, person with fibrotic changes on chest radiograph. Then patient with organo transplants and immunosuppressant patients. Duration of greater than or equal to 10 millimeter, mycobacterial laboratory personnel, injected drug users. Then recent immigrant from countries with high prevalence of TB. Then residents and employees of high risk congregate settings, like prison and jail, nursing, healthcare facilities, and residential facilities for patient with AIDS and homeless shelters. Then person with clinical conditions such as at high risk such as chronic renal failure, then diabetes mellitus, then silicosis, and some hematological disorders like leukemia and lymphosomas, and specific malignancies. Then infants, children and adolescents exposed to adults at a high risk for developing active TB. Then induration of 15 millimeter. Person with no risk factors for TB. Then limitations. Mantaux test does not distinguish between active and latent infection. If positive reaction occurs, additional tests such as chest X-rays, culture, and smear to establish the diagnosis of active TB. Factors that lead to false positive and false negative. False positive. False positive infection with non-tuberculosis mycobacteria. Second one, BCG vaccination. Then third one, administration of incorrect antigen. Then incorrect interpretation of results. False negative reaction. Yeah. Concurrent viral infection. Example, chickenpox, HIV, etc. Concurrent bacterial infection, typhoid fever, typhus, leprosy. Then concurrent fungal infection, chronic renal failure, low protein states, severe protein depletion, disease affecting lymphoid organs. Example, Hodgkin disease, lymphoma, chronic leukemia. Then immunosuppressive drugs, medical steroids. Then stress, surgery, burns, mental illness. Then vaccination using live virus. Then recent TB infection, children aged 6 months or less or elderly patients. Then side effects, fever, shortness of breath, rarely allergic reactions also occur, light headedness or fainting. Then application used to detect the infection by mycobacterium tuberculosis, used to determine any immune system by an individual who could have been or exposed to bacteria. Then it's university questions. Explain the principle, procedure, and application of Mantaux test. This is a 5-mark question. Okay, thank you.